and one, and we're live. TikTok live number 63. Top 5 listeners. I'm going to be giving you guys a shout out in the caption of the podcast, YouTube, etc. All right, let's get after it. Henry Hedgehog asked the first question: thoughts on Cornell as an OMFS resident? Cornell's it's good. It's good. At least now I don't know how it is now. I don't know how it is today. But when I applied to residency, Cornell was kind of like a country club program. I don't know if it's true, but they're given like a credit card, and every other week they do like a happy hour that they could throw on the credit card. I don't know if it's true. This was a rumor. This was 4 years ago. So this is a while, 4 or 5 years ago even. Yeah, this is a while ago. So I didn't get an interview at Cornell. I don't know if it's true. I do know residents that are there. I didn't ask them if they got a credit card for happy hours. But yeah, I think it's a pretty good residency from what I hear. It's in the city. If you are at a program that gives you a bit of time to use, like to see the city and explore and, some good free time, some weekends off, that's pretty awesome in a residency experience. Cali Girl 73 said hi. Hey, Cali Girl. How's it going? Apple user 3835 followed the live creator. Thanks, friend. Goober. What's up, Goober? You were on the last. Goober, I think you got number 1 spot. Yeah. Goober said in the comment right here, you better believe I'm coming for that number 1 spot again. I was going to say, dude, I remember you from the last TikTok live. Sweet. Thanks for coming on. What are we going to tackle today? What combos are we going to discuss? What are we going to get after? What's up, friends? Me joined. Who's up? Jay, lowest GPA you've seen get into dental school? Ooh, this is like 2-3 years ago. I saw someone with a 3.1 or 3.2 GPA get into dental school. I don't remember what school it was, but yeah, it was low. It might have even been like 2 point something. Might have even been like 2.9. No, it was low. It was very low. I was very surprised. Jala said, how many hours do you study? Well, in residency, not so many hours anymore. Because, like, for example, in residency, the times you like sit down, you make time to sit down. The rest of the year, you kind of like you're working a lot, and when you're outside of residency, you're reviewing, you're brushing up, you're preparing for surgeries and stuff. But other than that, it's kind of like you're kind of getting your life to live a little bit. Like I was just out on Smithtown, out on Long Island in Smithtown at my dad's place. It's the place I'm gonna buy in a couple months when I live out there to work in Melville. And yeah, so basically, it's only around those boards exams that you end up studying during residency. And what it kind of comes down to is when you are studying for those, you still have to work all day, all night. You're still on call every couple days. You know what I mean? So why? There's not like a set block of time that we would study. I would just study when I could, really, But yeah, so it's not so easy. It's not so clean cut. When I was in dental school, I used to study a significant amount of days. The most I would get were 15-hour days on the weekends when I was studying for the CBSE. That was my max, 15. I think I even hit like a 15 and a half hour day once. That's a lot. That like hurts your head in a weird way. User 1471, tips for an incoming D1. My school has GPA, but no ranking. Great. That's excellent. Just study hard. Get as much exposure to the specialties as possible, especially the ones that you like. Gravitate more and more towards them. Don't be malicious about going for specialties or general that you're interested in, right? Do your best. Do what you can, okay? Jala, how many hours do you study? Oh, I said that already. Jeremiah said, how you doing, Doc? What's up, Jeremiah? I'm doing pretty good. Just got home, spent the weekend out on Long Island with my dad. Played golf yesterday with Sean, Dr. Sean Czar. Dr. Czar on Instagram. He's my best friend from dental school. He's an orthodontist now. So shout out to him. He's in Brooklyn right now. He'll be moving to Great Neck over the summer, working in an office over there. And yeah, he's thriving. He's doing his thing, working a lot, working hard. And it was a good round of golf. I had some good shots. I didn't end the way I wanted to. I want to at least get under 100. I got like a 1-0. I don't know. Not great. It was my first golf round since last year. What, like 9 months, 10 months. So not bad. There were sparks of something good. Miles Forcier or Forcer 13. Thought of the day. Ooh, thought of the day. I would say always self-awareness, man. You got to be able to make time for what you're looking to do. You got to be able to, like, I was able to get out on Long Island this weekend. I did everything I had to do. I went for a run. And I had to compromise a little bit. I wanted to get abs in too. Didn't do it. Didn't want to get up early. I wanted to sleep in a lot this morning and catch up. Didn't get very good sleep last week. And we're about to go into another week. Actually, tomorrow morning, we have the commencement, the graduation commencement. So I got 2 weeks left. Guys, tomorrow I have 2 weeks left of residency, or like right now, technically. So unless I have to come back one more week for some surgery, I do need a couple more cuts in orthognathic surgery, and we do have cases planned. If I need them, which wouldn't be great because it would be taken from the next year's residence, so I'd really like to be done in 2 weeks. But, patients get sick. Things get rescheduled. Orthodontists think that they're not ready. Cases get pushed back, unfortunately. And cases have been canceled or rescheduled 6 out of the last 9 in the last 9 months that we've done. 6 out of 9 orthognathics were either canceled, rescheduled, or delayed, which is very frustrating. So to give you an idea, it's not just so clean cut. You don't just go to surgery every day, especially the bigger ones that take months to plan for orthognathic surgery, especially or specifically. Yeah, they take months to plan, and then all of a sudden, bang, they just get pushed back a couple months. So that you've been planning for like critical timing. Anyway, don't get me worked up on that. Don't get me worked up about that. Goober said very little about character limit. Sorry. Wait. Yeah, I missed that. First responders first. Let's go support our first responders. All right. We support our first responders. Absolutely. Of course we do. Giannine Elizabeth L. followed the live creator. Thanks, Giannine. Thanks, friend. Goober said, if you don't end up matching, do you think it's worth to scramble for a program that you know? Well, yeah. What's the alternative? What else are you going to do? What are you just not going to... You're going to give up and not match? No, you call up all the programs that have unmatched spots and say, hey, I've been eyeing your program for a while now. I see that you're unmatched. I didn't match. I'd love to be, your resident. Yeah, you scramble for a spot. Are you kidding me? What else are you going to do? Cali Girl 73 said, gosh, I remember the long, hard nights up all night. Yep, the long nights. Goober said very little about that you know very little about. Yeah, I think it's worth it if it's anything that think about it. Are you willing to go there or not? ME said, do you think most pre-dents dents or dental students or medical students idealize being a surgeon rather than the reality of the job? Yeah, I do think they do. I do think that they idolize it a bit, but as you get more exposure to it, you determine if you're willing to do that for a lifestyle, for your full life, for your residency, the years that you're in residency, 3, 4, 5, 7 years, some of these specialties, start in gen surge and then you go to cardiothoracic. These things go on and on and on. You're not starting to work until you're almost 40 years old. Anyway, so yeah, that's scary. Janny said, other than OMFS, what was your favorite department during dental school? Other than OMFS, I would say general. A lot of my friends were in general. That's not like a specific area. It definitely wasn't peds. Let me be clear that it definitely wasn't peds. I wasn't going to become a pediatric dentist. I don't know. Just working with kids is, oh man, they'll take the wind right out of you. But I don't know. I really don't know. My mentor was in perio when I did research with him, Dr. Romanos. I don't know if I would have gone perio though, That's I never thought about it really. Kelly girl, nice to have some downtime. I'm sure you needed. Yes, I needed, and it was nice. It was very nice, and now I'm happy to take some of the downtime to get on here. Wore this is my 21st birthday watch, and now that I'm 31, it's kind of like the 10-year anniversary because my birthday was last weekend, so I wanted to point that out. My dad got me for this for my 21st, and I changed the band a couple months ago because the other one, the screws kept falling out of the band, so it was like the band could fall off. But yeah, Amazon, nice little 23-inch band, and very comfortable. I think it fits the blue, the dark brown fits the blue nicely on it. So yeah. So shout out to Citizen Grand Touring Sport Automatic, the blue one. All right, let's keep going. Tylan said, incoming D1 wanted to do OMFS. Just wanted to say that I love the pods. Oh, thanks, man. Dude, I got to get another one coming out. I'm on a really tough rotation right now for timing, and we have these big early surgeries the next 2 weeks. So, I just planned a podcast with Dr. Steven. I think he's either Florida or Texas, but he's a pediatric dentist. But I think I might have to push that back because we have orthognathics Tuesday, Wednesday, and Friday this week. And then next week, Monday, Wednesday, Friday, I believe. Yeah. Or Monday, Friday. So that's 5 cases, and I need to get all of them in. So we'll see how it goes. But yeah, wow. I should really push back the podcast till the week after that, just because of timing's sake. So I got to figure that out. But then, how many more podcasts am I getting with this little background, this little studio area? Because once I move out of this apartment, I don't get this anymore. That's another thing I got to think about. Anyway, all right, let's keep it going. But thanks, Tylan. I really appreciate your kindness. Johnny Biscuits, ever work on cases with neurosurgery? Neurosurgery, sometimes frontal. I never got to, but sometimes with frontal sinus fractures, if the posterior table, and they want to cranialize it. Otherwise, sometimes if there's skull fractures when we're repairing, say, in the frontal sinus and do a coronal flap, perhaps. Sometimes. Jason MMO8 DDS. Yeah, I'm DDS. Rome went for a run. Nice. Oh, graduation commencement. Rome said graduation commencement. Cool. Thanks, man. Cali Girl 73 said, Brendan, hooray. Thanks, Cali Girl. Almost there. Not yet. 2 weeks. I think I started the countdown at 6 weeks, so a month ago. Yeah, every Monday I'm putting it up on LinkedIn and LinkedIn, Twitter or X, and Threads. I got to count it down. I got to count down the weeks, guys. It's been a while. Tylan said, Dot said my DAT is in 3 days. Good luck, Dot. Tylan said, good luck on the DAT. Goober said, know very little about. Yeah. I don't know about, I think you should still go for it, but it's going to be up to you. You got to look into these programs and see what people have said. Lola and Harmony said, I'm going to dental school, but people have been scaring me about the debt. What's your perspective? Well, do you have a game plan for paying back the debt? Because a lot of people go into these college, even let's just take undergrad. A lot of students go into college without really an end game plan. And how are you going to know what you're going to do for your career or for a job after college when you're so young and you've only been exposed to school, So more schooling, as you get more focused towards a career or job or specialty or something, as you're going through whatever process you want to do, it's a really good idea to figure out what the big picture game plan is, because that's not something they're asking students these days in school. And are you just going to, you know what I mean? Like, what are you getting that degree for? What are you going to do with it? What do you want for a career? Do you know you actually like the career? How exposed have you been to it? How much have you gotten to observe what that person does in that role? And then, especially with AI now, things are getting eliminated. I don't know which jobs are exactly getting eliminated, but I'm definitely better for startups in terms of AI. And you could definitely eliminate full departments using the AI models now. So that's something I'd consider. There's the world. It's a moving target. The career path's a moving target. You want to be able to see ahead of the road a little bit before you get caught up in at a speed bump. Jay, do non-cats have a good chance at matching? Have you ever met anyone who did more than one non-cat year? Yeah, I knew there was someone who did a second non-cat year when I was there at VCU. He did Rochester first, and then he did a second non-cat at VCU. Yeah, there are people out there that do multiple non-cat years, and that happens sometimes. Do you have a good shot at matching? It's hard to say. I do know a lot of four-year programs, four-year residency spots at programs. They take four-year resident non-cats in that four-year spot because they're going to be a little bit ahead of the curve. They're going to be ahead of the game as far as resident work goes. It's going to be hopefully a mature resident that you're taking on in a first-year spot, so it can really kind of help out the program in some ways. But I'm a four-year resident. I didn't do a non-cat, and I think it really depends on, it's going to come down to why do you need to do a non-cat, for example, right? Versus doing a GPR and then retaking the CBSE. I think it comes down to your CBSE. Like, do you need more exposure and experience in oral surgery before you apply again? Or do you just need to study and get that CBSE up? So I would recommend going the GPR route, get a little more time on your daily schedule to study and take that test again. Because in a non-CAD, a lot of these programs, your non-CAD spot, you're an intern level work. You're not going to have enough time to study for that test. Make sense? C. Benji said, what's the biggest complication you faced in surgery? There's a lot of complications. I mean, sometimes, now it hasn't happened to me, fortunately, but sometimes, if an orthodontic procedure doesn't go as planned, they still have an open bite, or now they went from a class 3 after the correction, now they're class 2. That's not good either. And they might need to have BSSO, a revision surgery, or one of the scariest things is I've done more than a dozen cancer cases this year, and more than half of them were neck dissections. Just like last week, we did a bilateral neck dissection. We did the left side and the right side. But when you're dissecting in around the carotid artery, you're looking at the IJ, the internal jugular vein, you're going near these critical structures. There was a chi leak at one point on one side. Now you got to dig it all the way down to kind of find the, oh my God. And you can't let that leak. That's just going to keep leaking and fill up with that fluid. And you got to find that thoracic duct and close it off. But going around like the IJ, dissecting around there, watching the attending do it, and God forbid you nick it, just blood goes everywhere instantly. And that's really scary. I think that's now it's a very short complication. You just clip it, you tie off the artery, whatever it may be, what have you. But you're holding your breath when they're dissecting around, and you're like, the biggest complication I've seen though, I would say cancer of the anterior mandible, metastases throughout the body, but the cancer out to here was like this. They couldn't talk, couldn't speak anymore except for a mumble, and it's very vascular. When cancer gets that big, it's very vascular and it's friable tissue, so it's ready to just come out like mush if you squeeze it hard enough. And when that happens, it just bleeds everywhere. Like everywhere. And how are you going to stop that from bleeding? You would need to either cauterize the entire thing, and even that, it might not hold up. It might continue bleeding. So, and I've seen that happen. That's probably the biggest complication, because bleeding out that much, you got to give them, massive transfusion protocol, MTP, and bags and units and units of blood. Anyway, let's move on. V, I want to be an OMFS, but I don't. Where'd it go? Where did it go? I want to be an OMFS, but I don't know what to do in undergrad in. Pick what you're passionate about in undergrad. In undergrad, to get into dental school, you just need to hit the prerequisites, right? Like Gen Chem, Orgo, Bio, and some other reading things and whatnot. So but do something you're passionate in, because that's going to really define who you are. And it's something you're going to be able to talk about on your interviews. Chicken Bake Mook. Did your program director say he liked when applicants extern there? I mean, generally it's a good idea to extern places that you want to go to, right? And yeah, I mean, they most programs will select people to interview that they liked on their externships. I think it's the best thing to do, and I encourage programs to do more of that. Interview the people based on the applicants that extern at your program, because they were interested, right? Well, you're gonna accept someone that wasn't interested in your program and had the opportunity to extern? Doesn't seem to make sense to me. OMFS DDS, so I feel like I want to do surgery or veneers, restorations. I can, right? I mean, I don't know of any oral surgeons that do veneers and restorations. I don't know anyone that's doing veneers. Tylan said, I hope these are the smoothest 2 weeks for you. Tylan, thank you. Thanks, brother. I don't know if they will be. It's going to be a long 2 weeks. It's going to be a very long 2 weeks. Luckily, like commencement, graduation's tomorrow, so it's technically a 4-day week. And then the week after is Memorial Day, so another 4-day week. So it's like they're going to be busy. They're going to be hectic. But 4-day weeks? Are you kidding me? This is the dream right now, right? Because I would want to do 4-day weeks with Mondays off after graduation. That's going to take years to get there, if at all. But that's the goal. SM.fit, thoughts on dental anesthesiology? I think it's good, but I don't know what the end path for dental anesthesiology is. Like, are they doing sedations and then restorations after that, working as a general dentist? Or are they doing like general anesthesia and sedations for other dentists? Both? I don't know. L, how much did CBSE knowledge help you in residency compared to just dental school clinical knowledge? Completely separate. Guys, the CBSE is essentially a board exam. It's a simplified board exam. So it's completely different from anything you've taken in dental school. That's important to know. Memory, narrow fit sunglasses. I know. I know you. What's up, Carrie? No idea how I ended up on dentist talk, but hi. Thanks, Carrie. Carrie Dowiak, the founder of Memory Sunglasses. They're for the narrow fit sunglasses for people with narrow faces. Apparently, I don't have a narrow face. Apparently, my face is, I don't know, wide or normal. I don't know what a medium face is. I don't know how to measure faces, but she does, and she makes narrow fit sunglasses. So shout out to Memory and Carrie. Good stuff. We got to meet. Come to Manhattan and let me know when you're here. We were talking about in a couple weeks, right? Goober said, if you did any externships, how many did you do and how long were they each? What's the golden number? Do just a 1 week externship. If you want to go back to a program, they invite you back for a second look, at their program. That's generally a good idea to do that. But the magic number of externships are 3. Try and get to 3 externships at the programs that you're that are either reach programs and the programs that you really want to go to. Okay. Reach programs because say you don't expect to get into this program, but it's a really good program and it's going to look good on your resume. It'll look good. And then say they really like you there that week. You just got yourself an interview at a place that you didn't expect, but you're really interested in going to. Okay, that's the best advice I could give you. Try and save your externships for later in the summer too. July, August, right around there. June, July, August. That's a good time if you can. Okay, the reason being is because now you're fresh in their memory when your application goes across their desk to give you that interview. All right. Matt Zano said, do you think AI can eliminate a dentist? It's going to be a long time. I think, as AI capabilities increase and enhance and further over time, I think it can eliminate the dentist, but it's going to eliminate a family medicine doctor before it eliminates a dentist. Put it that way. You know what I mean? Lola Harmony, thank you so much. You got it. Lola Harmony, thanks for coming on. User 12658, tips for incoming dental student. Study hard, keep your head on straight, get ready to do a lot of studying, get ready to have a lot of work. Tylan said, I don't think people want robots extracted thirds or placing implants. I agree. But we will have to see what patients actually think. Because what if it makes it more painless? What if it makes it more personalized so that implant fits the bone socket better after you have a tooth removed, and it gives you a tooth on that implant, a crown on an implant in a quicker amount of time because of all these factors, and it's a more comfortable visit. Then I'd argue, you know what I mean? It's kind of like the taxi versus the Uber. Yeah, I'd rather call an Uber from my apartment rather than standing out in the rain on the corner. It could go that direction where it's convenience, where you're saving time. That's what might happen. O said, what watch do you have on today? This is the Citizen Grand Touring Sport. It's an automatic. It's just a Citizen. It's not nothing. It's not like a Rolex or something. But I got this new leather band that I'm loving, and I think the dark leather matches the blue pretty well. Anyway, loving that. Thanks for asking. John said Ocean Eyes. That's a great song, by the way. Casey 1942 said, how many more days of residency? It's 2 weeks. So technically like 13 days, unless I don't get all my orthognathic cuts. Then I got to go into that first week of June. So 2 or 3 weeks. Not too bad. I'll make it. I'll survive. Kyle said, what's the best way to approach secondary application questions? Should mostly relate back to dentistry. Probably. I don't know. Secondary, I don't know, man. That's beyond me. I mean, I'll just answer it as honest as possible. Reading with cell, MODBL or crown? Oof, that's a good question. But I don't know. In oral surgery, I don't really worry about that stuff anymore. You let me know when you need me to extract that MODBL, all right? Let's start planning on that implant. Harris said, how often do you work with clinical pharmacists, if not at all? With clinical pharmacists, maybe with like, hey, we're trying to put this patient on this much of no, because pharmacy would be like asking, I don't know, we call Rikers Pharmacy if patients, we need to find out what medications they're on at the jail. But that's not really working with them. Here we go. On SICU rotation, we work with pharmacists because there's like a SICU pharmacist, I guess, assigned to the floor, goes with you on rounds, and she just adjusts all the medications, the tube feeds, like I said, it's dietitian. The dietitian does that. But yeah, she reviews all the orders, making sure people are getting an adequate amount of antibiotics. Oh, here's another one. With the pharmacist, we call them when we need to do the Vanc trough. Hey, do you want us to go up or down on the Vanc? You want to leave it where it's at? There you go. That's one. Hoff Blinders, how long did you study for the CBSE? I studied like 3 to 4 months for my first time taking it, and then about a month, maybe just over a month for the third time I took it. I didn't study for it the first time. It was the second and third time I studied. Gavin, favorite plating system? I don't know. I don't know. We'll see. The plating systems you have, KLS, you got Synthes, you got Stryker, you got Zimmer. And I don't know. We'll see. I could maybe I could make a recommendation in a little while. If maybe I don't know. Just whatever's there. Whatever's quickest. Give me the damn thing. What size screws? All right, put them in. Let's go. Gavin, favorite planes? Goober said Pacers or Knicks. Got to go Knicks. Yeah. Yep, that's right, Goober. Go Knicks. I'm a big fan of Brunson. I think Brunson's excellent. I think he's a really good. It's been a while since I've seen a basketball player that I've actually genuinely appreciated watching. He's a good basketball player. I saw him live twice last year, and I'm a really big fan of his work. I'm a really big fan of how he plays. Yep. So just my thoughts. And up there, how long do you study for the DAT? How did you study for the DAT and how long? I mean, I studied a bunch of things like DAT boot camp, Chad's videos, crack the DAT for the PAT, AP Bio book. You got boot camp is probably your best bet. DAT booster, DAT destroyer. And then how long did I study for? It was about a month and a half right after I graduated college. And then I had to take a gap year after I took it when I applied. But it all worked out. Don't be shy of taking the gap year. I think it's a good thing. If you have to take a gap year, don't choose to take the gap year. Obviously apply. If you have to take a gap year, don't shy away from it and don't feel like you're going to be a year behind. This is your year, and you're not going to understand that until years later when you had that trip and you wouldn't have got to go on that trip to Iceland during dental school. Take that trip now. This is your time during your gap year. Read books. Learn a new instrument. Try something new. Try new hobbies. I don't know. You know what I mean? That's your time to just explore a little bit more. Work 3 different jobs. Try music producing. I don't know. This is stuff like that I did. Work out, travel, see friends. That's your time to really kind of bloom and blossom into the person you can while still living at home, for example, with your parents, and they pay for most of the expenses. Great time to do that. How often can you take the CBSC? You can take it. Dree asked, how often can you take the CBSC and what did your timeline look like? 3 to 4 months. Do UWorld twice. The first time through, go section by section, learn everything using Sketchy Farm, Sketchy Micro, DAT Bootcamp, First Aid for the USMLE, and maybe Pathoma, and then go section by section, summarizing everything that you learn with the questions of UWorld. The second pass through UWorld, you're going to be doing the questions randomized, and I would do the first one every day timed. Try and get 3 to 5 blocks in a day. Okay, that's how I would study for the CBSE, and then maybe you mix an AMBOSS. Guys, look up CBSE dissection on YouTube. All caps CBSE dissection on YouTube. We put everything there. I made that video a year ago with Axe. It's good stuff in there. I've gotten a lot of people to tell me that on their second and third tries taking the CBSE, they've gone significantly higher using that video. So take it. Let me know what you think. All right. Goober said Brunson is a gift from God. Gavin, haha, it's a great surgeon's answer. Get it done with anything. Yeah. Sam _Miller.3, who's your winner of the NBA Finals this year? Your prediction? Oh, I don't know. I don't watch enough basketball to be able to give you that. I played in college, but unfortunately, I don't like to. I don't know. I always like to play stuff, not watch stuff. So I don't know. I'm really loving playing golf. I really enjoy that, and I like playing basketball, but I don't do it anymore because I'm worried about the risk of injury. And I don't watch it much. So I do like watching football, believe it or not. I do like watching the NFL. Tyrese Loves Cat said, did you ever share differing political views with co-residents? How was that? Yeah, probably not great. I mean, in the middle of Manhattan, the middle of NYU, people have a certain political view, and I try to stay away from that political view. I mean, we talk about, if something comes up and it's, unfortunately has like a political connotation, we kind of say what it, but we try and stay away from political views, political discussions. I think so. I don't know. I really don't talk about that stuff with other residents. Sam and Scrimmler, I'm considering being an ER doc to save and invest and eventually own urgent cares. Is it possible? Is it possible? Yes. But I think you need to think about how you're going to differentiate yourself between the trade, which is being the ER doc, marketing, which is getting new people to know about you or your urgent care center. That's the marketing, advertising, branding, okay, awareness. And then you have 3, which is the finances. The finances like plugging up all the holes in the boat to keep it afloat. That's what keeps the business afloat, okay, the finances. You got to be an expert, I would say, in at least 2 of those 3 if you want to open up an ER, an urgent care center, a dentist office, a specialty office. If you want to do that or open up a business, you need to be an expert or really, really, really talented and skilled at 2 of those 3 things. So that's something to think about. All right. I'm working on it with some things right now. And I would say I'm pretty strong with marketing, but I'm still learning. You're always still learning. It's going to be more interesting when I could do it around my own work as I'm going to be an associate in practice for 2 years, but maybe more as closer as like a partner or an owner. We're going to see how that kind of transpires. Where did you go for dental school? Would you recommend it? I went to Stony Brook. It's on Long Island. My class was 44 sides, which I really liked. Would I do it again? I don't know. I would probably apply to some of the Ivy League schools that were pass fail. I've got a hunch. I mean, it's going to be tough wherever you go, but I don't know. It was also like the culture varied from year to year. The environment varied between the year above us. They were all generally good friends. My year, it was very malicious. There was a weird vibe, like a weird energy that I didn't appreciate. I wish our dental school class got along better with each other. It was not great. But otherwise, I mean, the clinical experience was good. They match a very good number generally year after year into specialties. Yeah, yeah. Gavin, scope of practice post grad. Also, what part of the country are you going? I'm going to be I'll be in Melville on Long Island at a practice called All County Oral Surgery. They have several offices around Long Island, Manhattan, opening in July, August, and the owner of it all is Dr. Ross Chavkin. And yeah, so that's all I'll be. It's Long Island, New York. Joel Kabera said, did you know you wanted to do OMFS before dental school and during, or just when did you decide? I worked for an oral surgeon during my gap year as a surgical assistant. So I knew I was very, very interested in oral surgery. I really like that outpatient private practice clinical setting. I really like the idea of Monday through Friday. I don't want to take call anymore except for just for my practices. That's what I like doing, and that's what I'm going to do. I got to be happy. I need to thrive again. And I think things are going to really explode when I can thrive, because I'm going to be excited. It's going to be helping a lot of people. It's going to be working really hard. It's going to be building that practice of All County with Dr. Chavkin. I'm going to be exploring my side projects, side companies. I got a lot of things that we're going to release and that are going to come to with a little bit more time. I'll be able to work a bit more on all these too as well. So yeah, there's much to come. I'm pretty excited for it, but we will see. Yeah. So with oral surgery, did I know? Back to the question. let me start from the beginning. Joel Kabera, did you know you wanted to do OMFS before dental school or during? You just figured it out. I knew I wanted to do it. I was very interested in it, and then dental school and externships solidified it for me. Yeah. Did you take song requests? Country Girl 25 said, "Do you take song requests?" Sure. Big D said, "Hair transplants?" Nope. I don't have hair transplants. I have actual hair right there. You like that? Yep. Some people call it strawberry blonde. You could call it whatever you want. It's blonde though. Maybe I should keep this. Should I keep this due and go into work like that tomorrow? Should I go to the graduation ceremony with hair like this? What do you think? Pretty fire, huh? Anyway, Sam_Miller.3. I just feel like it's going to be difficult in the coming years to open up and own clinics as any doctor. Yeah, it is going to be very difficult. They're with inflation, with the retention of staff getting tougher and tougher because there's so many other opportunities out there. And then as well, I think you could combat that though. But then also private equity getting involved and insurance companies not reimbursing things adequately, but only reimbursing the multi-practices that use their patient population as leverage against them. It's creating a very monopolized landscape, which is very frustrating. So that's something, part of reality with dentistry and in healthcare in general, because on the medicine side, it's even worse. So yeah, that's just something to consider. Joel Cabera, do pass-fail dental schools look better or worse when applying to OMFS residencies? I mean, you can make the argument that if you're at a pass-fail dental school, the program director that's filtering out, looking at your application, isn't going to know how well you did in the school. But if you actually look at these schools that are putting out applicants to specialties, they do really well. It's the Ivy League schools. It's the Columbia. It's the Harvard. It's the, I think is UConn. I don't think UConn is ranked as well. Stony Brook is not ranked. And they all place really good numbers into specialties. So if you look at the results, yeah, the pass-fail dental schools generally have a great match to residencies in general, including OMFS. Becky said, "Do you ever meet people who are on second careers? I'm trying to pivot into medical school now. I'm 31." Nice, Becky. And yeah, all the time, people are in medicine or out of medicine on their second, even third career paths. Yeah, you see that. You see that quite a bit. C. Benji said, "Definitely keep the hair up like that." Dot said, "What's the best part of your job?" I like working with patients. I really like doing surgery. I like that. I like being a surgeon. Right now, I don't really enjoy residency, so I'm really looking to get out in private practice, and hopefully that kind of, I want to get back to that private practice feel when I worked as a surgical assistant for the oral surgeons in those offices. that private practice feel with a bunch of partners, that I miss that. I miss that a lot. That seems so exciting to me. And residency I got a lot of good friends in residency, and it's going. It's almost done. I got 2 or 3 weeks left. But yeah, I'm looking forward to life kind of getting back on the rails a bit in the direction I want it to go for once. And that'll be after graduating, Ethan Rensel said, is it true that there's no social life in med school for an average doctor path, nothing special? I would say residency and social life in residency is that's really more, that gets really, your social life during residency really gets boxed. It's bad in dental and medical school. It's a lot worse in residency. Your social life just kind of gets boxed into these little cubes. And I hate that. I had enough of it. I'm really looking forward to getting a normal life again, hopefully after residency. So Chitsab, you're going to OMFS. I'm in it. I'm not going. I'm in it right now. Diego Sueller, 0808. Do dental schools value a strong upward trend when it comes to GPA? Yeah, I think they do. I think all people would appreciate that. I think that's important. All right, friends, one more question, and then I got to sign off. This is TikTok Live number 63. The top 5 listeners. It shows me who's the top 5 who watched TikTok Live. I'm going to be giving you guys a shout out in the caption of podcast and YouTube. All right. Ethan Rensel said, looking into sports med, but don't want to throw away my adult life. Then don't throw it away. I mean, we got to work, right? But you either start something for yourself that you're passionate about, and then you're working for fun. It's serious, though. It's stressful, but you're working around something you like to do every day in, day out, and that may change over time as well. Or you just follow the path of the system, the educational system, and go from there. Look at both. Try both. That's what I think. I think try both. It's a lot harder, but you end up being a lot more satisfied. You won't regret, right? Ethan Ellis, do you find buccal fat pad useful in closing bigger oral entry communications? Not my favorite. It can help. It can help. How successful it is, I mean, it's generally told to be good, but then do you lose the vestibule on that side? I don't know. Chits Ab said, nice, just curious. You got to go through 2 years of medical school. Did you need to take the MCAT? No, I didn't do the 6-year program. I did the 4-year. I didn't have to take those 2 years in med school. Aaron Hickey said, I love you. Aaron Hickey said, by far my favorite person on social media. Really? Thank you, Aaron Hickey. Aaron Hickey also just got the number 2 gifted badge. Well, thank you, Aaron Hickey. I appreciate that. You're very kind. And just hit me up in a DM on Instagram. Let me know how I can help. I know it can be stressful at times. I know. Goober said, call me Tiger Woods the way I'm staying number 1 week in, week out. Let's go, Goober. All right, friends, that's the last one. Let's wrap this up. I want to have a little dessert or something to get ready for tomorrow. We got a big day. Thanks so much for coming on. This is TikTok Live number 63. And one last time, the top 5 listeners on this live that it shows me, I'll be giving you guys a shout out in the podcast. All right, friends. Thanks again. And love you guys. 2 weeks left. 2 weeks left of residency.